Hello, this is Daniel, and I'm going to teach. I'm going to talk about a teaching plan for my patient, who is a 90 years old male, um, who was administered to the hospital due to subdural hematoma. The patient has a history of hypertension. The patient had a surgery 4 days ago. Um, he currently has incision on his right anterior head. He's unable to balance himself while walking. Therefore, he needs a walker when he is walking. His body extremities are strong type 4, so um, he can remove all the devices that is close to him, or he can use the cobble by himself. Um, he's currently having a pneumatic compression device ordered around both legs to prevent deep vein thrombosis. The patient wants the device to be removed, stating, "It feels like I'm locked to the bed. I want this device to be removed and have alternative methods." As the patient is available to understand the conversation during evaluation, the nurse can check if the patient did understand what has been taught. However, as he can express his needs, he might refuse the device even though after teaching is done. The teacher will be done by having a teaching session for an hour with his family member to understand why he should have the device on him. The nurse has been diagnosed his diagnosis is deficit knowledge related to deep vein thrombosis as evidenced by inaccurate following through the instruction. However, after the teaching is done, the patient will understand why the pneumatic compression device should be on his leg and why he cannot have other methods such as tinzaparin for his to prevent deep vein thrombosis. First, the nurse will teach why the pneumatic compression device should be on. The device is a cuff around their legs that fill with air and squeeze their legs. This increases the blood flow through the veins of their legs and help preventing blood clots, which is the cause of deep vein thrombosis. To evaluate this, the nurse will ask the patient if they understood the information during the half time of the teaching session. And the second thing I'll talk with the patient will why the common used prevention for deep vein thrombosis such as tinzaparin, which is an anticoagulant, is not used for him. The patient has to be alert about this because as the patient came to the hospital due to subdural hematoma and has a hypertension, if the anticoagulant is administered to the patient, it can create a greater chance of reoccurrence of the subdural hemorrhage. Again, I'll ask this question: why the anticoagulant is not an alternative method for him for preventing deep vein thrombosis. The nurse will evaluate this by after 1 day of the teaching session. The nurse will come back and ask the same exact question that I asked at the half-minute period of the teaching session, so the nurse knows if the patient did understand or did not understand what they have learned in the teaching session. If the teaching session was unsuccessful and the patient didn't understand why their having a pneumatic compression device, or why they can't have a anticoagulant for a alternative method, the nurse will repeat a session, same as the last one, having a PPT with a teaching session, and again evaluate after a day to check if the patient did understand what and why this is important for him.